LunchCast at noon, where the facts rule.
And welcome back to the LunchCast. Governor Jan Brewer has signed 2 bills putting new restrictions on abortion in Arizona. One of those laws is the first in the country banning abortions based on race or gender. What's behind these new laws and what's their potential impact? It's our great debate today between the lead sponsor of one of those bills, Republican Representative Kimberly Yee of Phoenix, and Bryan Howard, Chief Executive of Planned Parenthood of Arizona. Thank you both for joining us today.
Thank you.
Let's talk about Representative Yee's bill first. Here's some of the details. It requires doctors to perform an ultrasound before an abortion and offer to show the ultrasound to the patient. It also expands state licensing to include clinics that perform medication abortions, and it bans the use of telemedicine for abortions. Representative Yee, what is the most important piece of this law and why?
This bill is about protecting women and their health and safety, and it's very important that they have that option to be able to view an ultrasound image of their baby and hear the heartbeat before they make that critical, life-altering decision of an abortion.
Mr. Howard, is that happening already?
Well, the one thing this bill doesn't have anything to do with is protecting women. First of all, you have to look at what actually changes under this law. Doing an ultrasound is already the community standard of care. It doesn't change anything. The big change is redefining taking the abortion pill as surgery, and as a result, disqualifying half of all abortion providers in the state from providing that care.
And that is the so-called medication abortion or medical abortion.
Correct.
Is that right? Wouldn't it make sense, though, since that is a relatively new procedure, to include that in licensing?
Well, it would make a lot of sense if you rewrote the licensing requirements, which we contributed to in 1999, to actually encompass and reflect what was involved in medication abortion. But those regs were written to govern surgery. This isn't surgery. You have a physical, you take a pill, and you leave the health center. It doesn't make any sense to merge taking the pill into a surgical abortion.
It's important to note that research has shown there's a 10 times greater risk of death when women take the abortion medication rather than a surgical abortion. That's research found, and there have been 8 deaths related to abortion medication. So it's not
in the U.S.
In the U.S., according to CDC. And so that's important to make sure that we have careful, high-quality standards for women in these abortion clinics all across Arizona, so that we are putting in place high-quality standards with a physician only, not substandard medical personnel to dispense this very dangerous medication.
You regard it as dangerous, you agree?
Well, absolutely not. The medication was approved by the FDA over a decade ago. It continues to be monitored by the FDA. If there was anything wrong with the medication, it would have been pulled from the market. And I think it's really inappropriate to suggest that nurse practitioners and physicians' assistants are substandard health care. This is where most Arizonans get their health care now, and to suggest that we shouldn't be trusting them is doing a disservice to them and to the patients who get their care.
41 other states have physician-only standards in their statutes that require physicians only to provide for abortions in these clinics.
I want to broaden the debate. The legislatures across the country are putting new restrictions on abortion. Is this part of a larger goal of getting Roe v. Wade reconsidered in the Supreme Court by provoking lawsuits?
I think it's important to make sure that taxpayers know exactly where their money is going. And in fact, Planned Parenthood's fact sheet says that in 2009, 3% of their services provided for abortions, which accounted to 332,000 abortions in this entire country. And that's a significant number of babies that were aborted.
So you're saying taxpayer money is paying for those abortions?
That is correct, according to the fact sheet that Planned Parenthood put out in March of this year.
It's your fact sheet. What does it say?
It is absolutely untrue. There are no taxpayer dollars spent anywhere in the United States from federal sources on abortion, and there are certainly no such dollars available in the state of Arizona. The representative knows that, and what this is about is making health care more difficult to get, and that's going to harm families. We have to remember that 55% of all women who got abortion last year in Arizona already have children at home. These laws impact entire families, and these are going to harm families.
One last question, Representative Yee. It seems is it not against federal law to provide money for abortions or to use federal money for abortions?
The dollars are indicated in what they have submitted to the federal government. And so if the government
isn't it against federal law to use federal money for abortions?
It shouldn't be legal, but there are subsidies that have been indicated to go to these types of abortions, and they're being paid for by tax dollars.
They're being...
All of our the family planning funds that we get from the federal government every year are audited every year by the federal government, by state authorities. Those audits are available. They're a matter of public record, and you know as well as I do that no dollars in Arizona are going, no public dollars are going to pay for abortion.
And we're going to have to end it there. Thank you for a great debate. I'm sure this will continue for probably years to come. Thanks so much.
Thank you.